Igor, and today we'll go talk about vascular tumors. Its abnormal growth of blood lymph vessel can be benign and malignant, can occur anywhere in body. Vascular tumors are rare but most commonly found in neonates, for example, hemangiomas, and HIV-positive individuals, for example, Kaposi sarcoma. Complication: metastasis, complication from chemoradiation therapy, sign and symptoms, see individual disorder. Diagnosis is diagnostic imaging, visual identification, imaging studies, MRI, CT scan, ultrasound with Doppler biopsy, determine location, tumor size, and extent of spread. Lab result is biopsy for definitive diagnosis. Treatment depends on type, location, severity, malignancy. See individual disorder. Angiosarcoma. Angiosarcoma is rare blood vessel malignancy involving blood vessel endothelial lining, aggressive, rapidly proliferating, poor prognosis. Can occur anywhere, usually occur in sun exposure area, for example, head, neck, breast. Cutaneous angiosarcoma occur beneath skin surface, most common. Can affect liver, blood vessel. Causes most likely due to lymphedema, fluid build up, causing swelling, radiation exposure, carcinogens. Risk factor: biological male, twice as likely, elderly patient, sun exposure, radiation therapy, chronic post-mastectomy lymphedema, frequent exposure to vinyl chloride, monomer gas in polyvinyl chloride, manufacturing arsenic insecticides. High grade, aggressive, fast growing. Low grade, less aggressive, slow growing. Complication: high chance of metastasis, poor prognosis, better prognosis for individuals with smaller tumor with clearly delineated margin. Low grade breast angiosarcoma has better prognosis than tumor with poorly defined borders. Signs and symptoms: lesion resembling non-healing bruise, wound. Violet color, soft, visible, tactile lump swelling, can form irregular vascular channel that disrupt tissue planes. Fatigue, bone pain, and anemia. Diagnosis is biopsy, usually diagnosed late after the disease has spread. Treatment is medication, chemotherapy, surgical difficulty to resect due to delayed diagnosis, and other intervention, radiation. In this slide, we see angiosarcoma of the skin. Glomus tumor. Glomus tumor is a benign tumor arising from modified smooth muscle cell of skin thermoregulatory glomus bodies. Derives from small vessel arteriovenous anastomosis in glomus bodies. Malignancy, metastasis rare. Etiology includes loss of function, mutation of protein glomulin in familial glomangiomas. Complication: good prognosis, low recurrence rate after resection. Malignant glomus tumor rare, have good prognosis when treatment with wide excision. Metastasis associated with poor prognosis. Risk factor is adult, or adult is 20 to 40 years of age. Most lesions solitary, localized, autosomal dominant inheritance pattern. Biopsy of the glomus tumor. Signs and symptoms: painful small red-blue growths, pain associated with solitary lesion. Younger individuals multiply tumor, usually asymptomatic, usually found on distal extremities. Paroxysmal pain depending on temperature, pressure changes, cold, pressure worsening pain. Diagnosis: other diagnostic is visual inspection or occasional imaging. Surgery, resection treatment. Treatment is resection. Kaposi sarcoma is malignant vascular tumor, lesion of blood vessel endothelial cell due to human herpes virus 8. Virus penetrates cell, causing uncontrollable replication, may involve visceral organs. Progression severity of tumor depends on underlying factor, genetic, usually seen in older Eastern European males. Tumor localized to skin. AIDS tumor spreads staging below organ transplant recipients. Tumor spreads. Types AIDS-related, most commonly malignancy in AIDS, immunocompromised, iatrogenic related, classic sporadic, endemic African, Burkitt lymphoma due to Epstein-Barr virus. Risk factor is immunocompromised individuals, AIDS, Kaposi sarcoma associated with human herpes virus 8, organ transplant, biological male, Eastern Europe, high risk biological male individuals engaging in same-sex sexual acts. AIDS-related Kaposi sarcoma takes three factors into account: extent, severity of tumor, tumor 0, localized tumor, tumor 1, widespread multiply lesions that spread to other organ, CD4 cell count, immune status 1, 0, CD4 count above 150 cell per millimeter cubical, and 2, CD4 count less than 150 cell millimeter cubical, present, absence of systemic illness, no systemic illness, opportunistic infection, and or B symptoms. B symptoms: systemic fever, night sweat, weight loss, diarrhea. S1, present of systemic illness, opportunistic infection, and or B symptoms. Complication is lymphedema, bleeding, infection, long-term hyperpigmentation. Prognosis depend on individual's immune status, viral load, amount of HIV virus in blood. Most common symptoms affected skin also affect mouth, GI tract, respiratory tract, progress from flat lesion to plaque and ulcerative nodule. Purple-red lesion similar to bruise that does not blanch. Lesion starts off flat, may become rise more painful. Lesion in other tissue, mouth, nose, throat, lymph node, lung, gastrointestinal tract, commonly found in mucous membrane, heart plate, for example. Pulmonary symptoms: pulmonary Kaposi sarcoma, coughing, possible bloody cough, and dyspnea. Is known in patient with Kaposi sarcoma. Diagnosis: Diagnosis based on bronchoscopy, endoscopy, lab result, biopsy, and treatment depends on severity of immunosuppression, number, location of tumor, and symptoms. Medication: HIV/AIDS management with antivirals, control HIV/AIDS lesion shrink. Removal of drugs, for example, corticosteroids, or allow immune system to recover, treat more difficult individuals who immunocompromised, chemotherapy, surgery remove affected skin, other interventions, cryotherapy, freeze affected skin, radiation. Thank you, subscribe to the channel.